Life is built off of the basis of perception. Perception not only metaphorically, but literally in terms of anatomy, in terms of vision. Vision builds the basis of life. It builds the basis of perception and other senses. And without it, there is no life. So, through my proposals today for improved early detection and treatment of glaucoma, not only am I providing a systematic review with further analysis addressing one of the second widest leading causes for blindness, but I'm also introducing new perceptions and new perspectives through neuroscience and vision. My name is Anushka Praveen, and my mentor through this research project was Katie Cording, who helped me not only research, but she helped me in my passion. I love to play the guitar, I love doing Model UN, and I love to do sprints and triple jump for track and field. These build the basis of my passions. I'm presenting from Pleasanton, California, and I go to Foothill High School as a sophomore. But why did I choose glaucoma? Well, neuroscience is a passion of mine because, first, the brain is the most complex object of the body. But not only because of that, neuroscience has this personal connection to me. My grandfather in India was diagnosed with glaucoma when I was born. And because of this, since my birth, he wasn't able to get a treatment. And because of that, he became a blinded visualizer. He wasn't able to see the world around him, read books, read newspapers, watch movies, or see his children or grandchildren grow. And because of this, I truly realized that my passion in life is combining my learning in neuroscience to treat these such impactful neurodegenerative diseases. Because of that, I love helping people, especially people in underprivileged areas. And I did this through volunteering for a psychology nonprofit, lecturing neuroscience, and more. And by far, one of my biggest achievements is writing this paper because I truly feel like I was able to use it in order to help people and truly take a step towards helping people with neurodegenerative diseases like glaucoma. So the goals for my research is to examine glaucoma as a neurodegenerative disease, analyze gaps in treatments and diagnostics, address new diagnostic factors, new proposals for treatments, and share my findings to both introduce more feasible diagnostics and treatments so that more people will get their vision. So the research question I asked myself are what are potential effective practices that can be taken to improve early detection as well as methodical and efficient treatments for glaucoma? So what is glaucoma? It's a neurodegenerative disease, but this is what it looks like. This is what an eye looks like. It's darkened around the peripheral and there are some spots. It's not a very, it's a sight for sore eyes. So glaucoma is characterized by the degeneration of the optic nerve. As you can see here, the eye is white. And because of this, it's also because of retinal ganglion cell loss, which are bridging neurons. These help transmit signals from the eye to the brain as well. And eventually it leads to tunnel vision or blindness. But what exactly happens in glaucoma? Well, here in this cavity, in another cavity called the ciliary body as well, aqueous humor, which is the fluid in the eye, typically drains through this meshwork around here. But sometimes it doesn't, such as in glaucoma. And this fluid can build up in this area, causing intraocular pressure to build up. And because of this, there's changes in the optic nerve, such as degeneration. And because of that, the brain isn't able to get signals transmitted or perceived. Glaucoma has a variety of risk factors in addition, such as genetics and family history, old age, vasospasms, which are the narrowing of blood vessels, such as arteries, smoking, and diabetes. But what exactly is the current problem to address with glaucoma? Well, in terms of diagnostics, so many cases go undiagnosed, and family histories are often incomplete because glaucoma only typically arrives symptomatic during late stages. In terms of treatments, the current treatments only work to reduce the risk of advancement of glaucoma, even though glaucoma is diagnosed during very irreversible stages. So, what exactly is the treatment doing? It isn't doing much because there's a lack of solutions mitigating the effects. it isn't helping vision get restored. So today I want to share diagnostics that can hint at glaucoma earlier and treatments that can mitigate blindness even during late diagnostics. My first way to do so is through proposal for early detection of glaucoma through examining the brain. One of the key things to get through first is by examining key terms of the brain. Today I'm connecting neuroscience with sciences of the eye. And because of this, I'm introducing the SMG, the supramarginal gyrus, which controls balance, the SLF, which is a nerve bundle of fibers that connects the visual occipital, which basically also helps process, and it connects parts of the brain that does balance processing. There's also BOLD, blood oxygenation level dependent signals, which also help to measure blood flow and oxygenation. And lastly, white matter, which is deep within the brain and it's a bunch of collections of neurons. So this is what a typical visual processing looks like. It travels from the eye to the optic nerve and then back to the occipital lobe to get processed. But in glaucoma, there's various neurological changes, not just in the visual cortex. For example, the visual occipital over here is no longer connected or has loss of functional connectivity to the SMG, and the SMG controls balance, so it sort of shows a relationship to improper balance. There's also increased bold deviation signals, and because of the deviation and increased deviation in signals, the blood oxygenation is often unstable, showing instability or low neuron activity in the brain in these regions. And lastly, there's white matter shrinkage, which is essentially neuron shrinkage and death in the SMG, SLF, and many areas controlling balance. But the one key thing bridging all of these are problems with vestibular or balance. Another way to detect these symptoms is through this analysis. If the visual occipital is no longer connected to the SMG or has low functional connectivity, it leads to unsteady gait, which is unsteady walking. If white matter, such as neurons, are damaged, there'll be poor balancing control. If there's increased bold deviations, it often leads to lower neural activity. It can also explain the vasospasms that occur as a risk factor. And if there's white matter shrinkage in these areas, it also leads to increased falls because these areas are related to balance. So, what exactly does this all mean? It means that glaucoma is not just a visual disease, but can be seen in the problems in balance. And there are other symptomatic tests we can detect glaucoma with now, such as the timed up and go test, which tests gait or your ability to walk in a timely fashion. The 9-item Berg balance scale, which basically scales and tests your balance. POMA and the functional gait assessment, which tests also your walking and your balance through that. Now we have an increased variety of symptomatic tests, and now we can potentially diagnose glaucoma early on. The second thing today is proposals of vision stimulating technologies for glaucoma patients, because current treatments are only addressing reducing the advancement rather than reducing the hindrances. In normal vision, the light hits the frontal part of the eye or the cornea. It's focused on the back of the eye or the retina and sends messages through the optic nerve, which sends signals to the lateral geniculate nucleus in the middle of the brain, which starts the processing, and then it lastly sends signals to the visual cortex to create a visual perception. And because of that, your brain is able to see the image. And in regular vision perception, there's many features that help perception, not just eye light detection. For example, feature detector neurons, which detect color, shape, and depth. There's the blind spot in which the optic nerve actually blocks a spot of light in your brain. So there's actually a dark spot, but you can't see it because your brain combines left and right visual field signals in order to fill it in using pattern completion and knowledge. Lastly, there's HPC. HPC is essentially your brain using its previous knowledge of your surroundings to determine a perception of what you're about to see. Then, when the signals travel in from your eye to your brain, it corrects the perceived or the predetermined perception to actually form your perception. So it's predictive and it creates patterns. But in glaucoma, as you can see, you have peripheral darkness. You are unable to see many colors or fine details or light. And this is because of low white matter and neuron connectivity in the primary visual cortex. And because of that, you aren't able to perceive properly. So truly the problem is in your perception. So what's the solution for this? The solution is to create a perception stimulating device, not just addressing the furthering of advancement of glaucoma, but it actually helps the real problem, which is forming a visual perception. The way to do this is A, identify the regions of the brain to stimulate perception. As you can tell, peripheral vision is the most damaged because also there are low bold signals and white matter integrity. Glaucoma-related problems are often found in the anterior calcarine cortex, which is the front part of the visual cortex, and this also controls peripheral vision processing. So we need to stimulate that part of the brain to stimulate peripheral vision. But how do we do that? We find pattern stimulating neurons. Like the blind spot, we need to find neurons that essentially use technology to find neurons that activate connections and computations of patterns so that your brain can use patterns to fill in dark spots, like your peripheral vision, such as PatMat, which uses statistical models such as conditional random fields to detect this. Next, you need stimulating therapies to actually stimulate these neurons in this cortex. You should use one electrode for detection and one electrode for stimulation, and it will do so through magnetic forces and nanodiscs in which the neurons respond to. And lastly, you insert these electrodes into this part of the brain in order to stimulate peripheral visual completion through surgery. But what does this all mean? It means to stimulate HPC, predictive pattern filling, and visual pattern completeness. There's a darkness around your peripheral vision, like your blind spot, and this device would essentially detect pattern completion neurons and stimulate those in the cortex that can control peripheral vision in order to form a perception, a completion, a pattern completion of vision. The problem is your visual perception, and through this, even if you have a late diagnosis, sticks, and even if your optic nerve is damaged, you can predict a pattern and thus form perception. Because of this, you're able to get new treatments and help people around the world gain vision. And my goal through this is to analyze new perceptions, analyze neurology, and analyze treatments and medical devices in order to spread these techniques, in order to spread the ability to perceive around the world. Thank you.